They say there's no such thing as a silver bullet. And we know that today's health problems are complex and interrelated. But what risk factor do liver disease, teen pregnancy, depression, COPD, headaches, heart disease, and suicide attempts all have in common? The Adverse Childhood Experience Survey was initiated in 1995 by Kaiser Healthcare and the CDC. The epidemiological study tracked the health outcomes of 17,000 adults in the U.S. who completed a simple 10-question survey about potentially traumatic childhood events, including abuse, neglect, or household dysfunction. The study results were astounding. Almost two-thirds of participants experienced at least one event. The 12% of people who experienced 4 or more events were 2.5 times as likely to develop liver disease, 4 times as likely to develop COPD, 5 times more likely to be depressed or become alcoholics, 6 times more likely to be raped later in life, 12 times more likely to attempt suicide. Additionally, the likelihood of these outcomes was directly proportional to the ACES scores. To explain the range of outcomes, researchers theorize that adverse events create a higher likelihood of problem behaviors that lead to poor health outcomes. Although a number of neurological studies have been conducted to understand the mechanisms that mediate this relationship, more research is needed. In the meantime, it's important to consider life course events when planning prevention and health education initiatives. Early childhood interventions like parental trainings and Head Start programs may significantly reduce the risk of adverse health outcomes later in life. Resilience initiatives can also utilize family and community supports to minimize the harmful effects of traumatic events. And the movement across professionals, institutions, and disciplines towards trauma-informed services plays a crucial role in mitigating childhood trauma and setting kids up for a healthy future.